Question 1. Process analysis reveals a patient presenting with persistent insomnia, daytime fatigue, and a recent diagnosis of generalized anxiety disorder. The patient reports that their anxiety symptoms have worsened significantly in the past 6 months, coinciding with the onset of their sleep difficulties. They express concern that their lack of sleep is exacerbating their anxiety, and their anxiety is making it impossible to fall asleep. As a certified clinical sleep health professional, what is the most appropriate initial course of action? Option A. Focus exclusively on implementing a strict sleep hygiene protocol and suggest over-the-counter sleep aids, as insomnia is the primary presenting complaint. Option B. Prescribe a short-term course of a sedative hypnotic medication to address the insomnia immediately, pending further evaluation. Option C. Recommend a comprehensive sleep assessment, including a detailed sleep history and a review of potential sleep hygiene issues, while also strongly recommending a concurrent evaluation by a mental health professional to address the generalized anxiety disorder and its potential impact on sleep. Option D. Advise the patient to prioritize their mental health treatment with their psychiatrist and suggest that sleep issues will likely resolve once their anxiety is better managed. Correct answer is C. Recommend a comprehensive sleep assessment, including a detailed sleep history and a review of potential sleep hygiene issues, while also strongly recommending a concurrent evaluation by a mental health professional to address the generalized anxiety disorder and its potential impact on sleep. Explanation. This scenario presents a professionally challenging situation due to the complex interplay between a patient's reported sleep disturbances and their diagnosed mental health condition. The challenge lies in differentiating primary sleep disorders from sleep disturbances that are secondary to or exacerbating the mental health condition, and in determining the most appropriate and ethical course of action within the scope of clinical sleep health practice, as defined by the Certification in Clinical Sleep Health (CCSH) framework. Careful judgment is required to avoid misdiagnosis, inappropriate treatment, and potential harm to the patient. The correct approach represents best professional practice by prioritizing a comprehensive assessment that integrates both sleep and mental health evaluations. This aligns with CCSH guidelines that emphasize a holistic patient-centered approach and the importance of interdisciplinary collaboration. By recommending a referral to a mental health professional for a concurrent evaluation, the clinician acknowledges the potential bidirectional relationship between sleep and mental health. This ensures that the patient receives appropriate care for both aspects of their health, preventing the exacerbation of either condition and promoting overall well-being. This approach adheres to ethical principles of beneficence and non-maleficence by seeking to provide the most effective and safe care. An incorrect approach that focuses solely on treating the reported insomnia without a thorough mental health assessment would be professionally unacceptable. This failure to consider the underlying or contributing mental health condition represents a significant ethical lapse, potentially leading to ineffective treatment and a delay in addressing the root cause of the patient's distress. It violates the principle of beneficence by not providing the most appropriate care. Furthermore, it could be seen as a regulatory failure if CCSH standards mandate consideration of co-occurring conditions in treatment planning. Another incorrect approach, which involves solely treating the mental health condition and disregarding the reported sleep disturbances, is also professionally unacceptable. This neglects the significant impact sleep has on mental health and vice versa, as recognized by CCSH. Ignoring the sleep component could lead to persistent sleep problems that undermine the effectiveness of mental health treatment and negatively impact the patient's quality of life. This demonstrates a lack of comprehensive understanding of sleep health principles and could be considered a failure to meet the patient's stated needs. A third incorrect approach, which involves a superficial sleep assessment and immediate prescription of medication without further investigation, is ethically and professionally unsound. This approach risks masking underlying issues, potentially leading to dependence on medication, and failing to address the complex etiology of the patient's symptoms. It bypasses the thorough diagnostic process expected within clinical sleep health, and could be seen as a deviation from best practices and regulatory expectations for responsible patient care. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly gather patient history, including detailed sleep patterns, mental health history, current symptoms, and any treatments received. 2. Conduct a comprehensive sleep assessment, utilizing appropriate diagnostic tools and considering differential diagnoses. 3. Evaluate the potential impact of mental health conditions on sleep and vice versa. 4. Consult with or refer to other healthcare professionals, e.g., mental health specialists, physicians, when co-occurring conditions are suspected or identified. 5. Develop an integrated treatment plan that addresses all identified health concerns in a coordinated manner. 6. Continuously monitor patient progress and adjust the treatment plan as needed, always prioritizing patient safety and well-being. Question 2. The performance metrics show a consistent pattern of delayed sleep onset and reduced daytime alertness, which the patient attributes to a night owl tendency. However, the metrics also indicate significant variability in sleep duration and wake times throughout the week, deviating from typical patterns for even a pronounced evening chronotype. Based on the Certification in Clinical Sleep Health, CCSH, scope of practice, what is the most appropriate initial interpretation and course of action? Option A. Conclude that the patient has a primary insomnia disorder due to the inconsistent sleep duration and daytime alertness issues, and recommend standard cognitive behavioral therapy for insomnia, CBTI. Option B. Investigate for a circadian rhythm sleep-wake disorder, such as delayed sleep-wake phase disorder, by assessing the patient's habitual sleep-wake times, light exposure patterns, and social/occupational demands, and consider interventions to realign their internal clock. Option C. Focus solely on the delayed sleep onset, assuming it is a fixed trait, and recommend strategies to manage daytime sleepiness without addressing the underlying variability in sleep duration. Option D. Advise the patient to simply adhere to a stricter sleep schedule, forcing an earlier bedtime, as the variability in sleep metrics suggests a lack of discipline. The correct answer is B. Investigate for a circadian rhythm sleep-wake disorder, such as delayed sleep-wake phase disorder, by assessing the patient's habitual sleep-wake times, light exposure patterns, and social/occupational demands, and consider interventions to realign their internal clock. Explanation. Scenario analysis. This scenario presents a common challenge in clinical sleep health where objective data, performance metrics, conflicts with a patient's subjective experience and established physiological understanding of circadian rhythms. The challenge lies in interpreting these metrics within the context of the patient's specific chronotype, lifestyle, and potential underlying sleep disorders, while adhering to the CCSH scope of practice and ethical guidelines. A purely data-driven approach without considering the biological underpinnings of circadian timing can lead to misdiagnosis or ineffective treatment. Correct approach analysis. The correct approach involves integrating the performance metrics with a comprehensive understanding of circadian physiology and chronobiology. This means recognizing that deviations in sleep onset, duration, and timing, as reflected in performance metrics, can be direct manifestations of circadian rhythm disruptions. Best professional practice dictates a holistic assessment that considers the patient's chronotype, e.g., morningness, eveningness, typical sleep-wake patterns, and environmental influences, light exposure, work schedules. By correlating these factors with the observed performance metrics, the clinician can accurately identify the nature of the circadian rhythm issue and formulate an evidence-based intervention, such as chronotherapy or sleep hygiene modifications tailored to the patient's biological clock. This aligns with the CCSH mandate to provide evidence-based care for sleep disorders, which inherently includes understanding and managing circadian rhythm disturbances. Incorrect approaches analysis. One incorrect approach is to solely focus on the performance metrics as indicators of poor sleep quality without considering the underlying circadian timing. This fails to acknowledge that the metrics might be a consequence of a misaligned internal biological clock, not necessarily a primary sleep disorder like insomnia or sleep apnea. This approach risks misinterpreting normal variations in sleep timing for a specific chronotype as pathology, leading to inappropriate interventions. Another incorrect approach is to dismiss the performance metrics entirely because they don't align with the patient's subjective report or a preconceived notion of normal sleep. While subjective experience is important, objective performance metrics, when interpreted correctly within the framework of circadian biology, provide valuable insights into the timing and consistency of sleep-wake cycles. Ignoring this data can lead to overlooking significant circadian disruptions that are impacting the patient's health and well-being. A third incorrect approach is to immediately recommend pharmacological interventions without a thorough assessment of the circadian rhythm. While medications can sometimes be used in managing sleep disorders, they are often not the first-line treatment for circadian rhythm disturbances and can mask underlying issues or create new problems if not prescribed judiciously based on a complete understanding of the patient's chronobiology. This approach bypasses the crucial diagnostic and therapeutic steps related to circadian rhythm assessment. Professional reasoning. Professionals in clinical sleep health should employ a decision-making framework that prioritizes a comprehensive, patient-centered, and evidence-based approach. This involves 1. Data acquisition, gathering all relevant data including objective performance metrics, subjective reports, medical history, and lifestyle factors. 2. Physiological contextualization, interpreting the acquired data through the lens of established sleep science, with a particular emphasis on circadian rhythm physiology and chronobiology. 3. Differential diagnosis, considering all potential sleep disorders and contributing factors, including primary circadian rhythm disorders, secondary disruptions, and other sleep pathologies. 4. Treatment planning, developing a personalized treatment plan that addresses the root cause of the sleep disturbance, prioritizing non-pharmacological interventions where appropriate and considering pharmacological options only after thorough assessment and in conjunction with other therapies. 5. Patient education and collaboration, engaging the patient in the decision-making process, educating them about their condition, and fostering adherence to the treatment plan. Question 3. Benchmark analysis indicates that a patient diagnosed with moderate obstructive sleep apnea, OSA, has been using CPAP therapy for 6 months, but continues to report significant daytime sleepiness and snoring. The clinical team needs to determine the most appropriate next step in management. Which of the following represents the most evidence-based and patient-centered approach? Option A. Conduct a thorough reevaluation of CPAP adherence and efficacy, investigate potential contributing factors to persistent symptoms, and consider optimizing CPAP settings or exploring alternative therapies like oral appliances or surgery if CPAP remains ineffective. Option B. Prescribe a stimulant medication to manage daytime sleepiness while continuing the current CPAP regimen without further assessment. Option C. Advise the patient that persistent symptoms despite CPAP are common and suggest they simply try to adhere better without further investigation. Option D. Immediately refer the patient for surgical consultation to address potential anatomical issues contributing to their OSA. Correct answer is A. Conduct a thorough reevaluation of CPAP adherence and efficacy, investigate potential contributing factors to persistent symptoms, and consider optimizing CPAP settings or exploring alternative therapies like oral appliances or surgery if CPAP remains ineffective. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient with diagnosed obstructive sleep apnea, OSA, exhibits persistent symptoms despite initial CPAP therapy. The professional challenge lies in determining the most appropriate next step in management, balancing patient adherence, symptom resolution, and the availability of alternative treatment modalities, all while adhering to established clinical guidelines and ethical responsibilities. The decision requires a comprehensive evaluation of the patient's response to CPAP, potential contributing factors to treatment failure, and the evidence base for alternative interventions. Correct approach analysis. The correct approach involves a thorough reevaluation of the patient's CPAP adherence and efficacy, coupled with an investigation into potential reasons for persistent symptoms. This includes assessing mask fit, pressure settings, humidification, and patient comfort. If adherence is suboptimal or efficacy is questionable, further diagnostic testing, such as a repeat polysomnogram or titration study, may be warranted to confirm the diagnosis and optimize CPAP settings. If CPAP remains ineffective or poorly tolerated after optimization, a discussion of alternative treatments, including oral appliances or surgical options, based on the patient's specific anatomy and OSA severity, represents best professional practice. This aligns with the principle of patient-centered care, aiming for the best possible outcome through evidence-based interventions and shared decision-making. Adherence to the Certification in Clinical Sleep Health, CCSH, framework emphasizes a systematic and evidence-based approach to sleep disorder management. Incorrect approaches analysis. One incorrect approach would be to immediately recommend surgery without a comprehensive reevaluation of CPAP therapy and exploration of less invasive alternatives. This fails to adhere to the principle of escalating care appropriately and may expose the patient to unnecessary surgical risks and costs when CPAP could potentially be optimized or an oral appliance might be effective. Ethically, this bypasses the standard of care for OSA management. Another incorrect approach would be to dismiss the patient's persistent symptoms as noncompliance without investigating objective reasons for CPAP failure. This demonstrates a lack of thoroughness and can lead to patient frustration and disengagement from care. It also fails to acknowledge that CPAP intolerance or suboptimal efficacy can stem from various factors beyond simple non-adherence. A third incorrect approach would be to recommend a different, unproven, or poorly evidenced treatment modality without a clear rationale or supporting data for this specific patient's presentation. This deviates from evidence-based practice and could potentially harm the patient or delay effective treatment. Professional reasoning. Professionals should approach this situation by first confirming the diagnosis and the initial treatment plan's effectiveness. This involves a detailed review of CPAP data, patient-reported symptoms, and adherence logs. If CPAP is not achieving desired outcomes, the next step is to identify the barriers to success. This might involve troubleshooting CPAP equipment, adjusting settings, or exploring behavioral interventions for adherence. If these measures are insufficient, a systematic evaluation of alternative treatments, considering the patient's individual characteristics and the evidence supporting each option, is crucial. This iterative process of assessment, intervention, and reassessment ensures that the patient receives the most appropriate and effective care. Question 4. The performance metrics show a higher than expected rate of patients diagnosed with complex sleep apnea syndrome, CompSAS, who do not achieve optimal treatment outcomes with standard positive airway pressure, PAP, therapy alone. As a certified clinical sleep health professional, what is the most appropriate next step in managing these patients? Option A. Refer all patients with CompSAS to a physician for a second opinion without further independent assessment of their specific case. Option B. Conduct a thorough reevaluation of the patient's medical history, comorbidities, and polysomnography data to identify factors contributing to treatment resistance and consider advanced therapeutic options like adaptive servoventilation ASV, based on established guidelines. Option C. Increase the pressure settings on the existing PAP device without further diagnostic investigation or consideration of alternative therapies. Option D. Continue standard PAP therapy, assuming that adherence issues are the primary cause of suboptimal outcomes, and focus solely on improving patient compliance. The correct answer is B. Conduct a thorough reevaluation of the patient's medical history, comorbidities, and polysomnography data to identify factors contributing to treatment resistance and consider advanced therapeutic options like adaptive servoventilation, ASV, based on established guidelines. Explanation. The performance metrics show a concerning trend in patients diagnosed with complex sleep apnea syndrome, CompSAS, at your sleep center. This scenario is professionally challenging because CompSAS requires a nuanced understanding beyond simple obstructive sleep apnea, OSA, treatment. It involves the interplay of OSA with other conditions, often necessitating adaptive servoventilation, ASV, or other advanced therapies, and carries a higher risk of treatment complexity and potential adverse events. Accurate diagnosis, appropriate treatment selection, and ongoing patient management are critical for patient safety and adherence, directly impacting clinical outcomes and the center's reputation. The correct approach involves a comprehensive review of the patient's medical history, comorbidities, and polysomnography, PSG data to confirm the diagnosis of CompSAS and identify contributing factors. This includes evaluating for conditions like heart failure, Cheyne-Stokes respiration, or central sleep apnea components that define CompSAS. The subsequent step is to consider advanced therapeutic options, such as ASV, based on established clinical guidelines and the patient's specific presentation. This aligns with the CCSH certification's emphasis on evidence-based practice and patient-centered care, ensuring that treatment decisions are informed by the latest research and best practices for complex sleep disorders. Adherence to these principles is paramount for ethical and effective patient care within the scope of clinical sleep health. An incorrect approach would be to solely rely on standard positive airway pressure, PAP, therapy for all patients diagnosed with COMP SAS, without further investigation or consideration of alternative therapies. This fails to acknowledge the distinct pathophysiology of COMP SAS and the potential inadequacy of standard PAP, leading to suboptimal treatment and potentially worsening patient conditions. This approach could be considered a failure to adhere to the standard of care and may violate ethical principles of beneficence and non-maleficence by not providing the most appropriate treatment. Another incorrect approach would be to initiate ASV therapy without a thorough evaluation to rule out contraindications, such as specific cardiac conditions or the absence of a significant apneic component. This could lead to patient harm and is not supported by evidence-based guidelines for ASV use. This represents a failure to exercise due diligence in patient assessment and treatment selection, potentially leading to adverse events and a breach of professional responsibility. A third incorrect approach would be to discharge the patient without a clear treatment plan or follow-up, assuming that a COMP SAS diagnosis automatically implies a specific treatment. This neglects the ongoing management required for complex sleep disorders, including monitoring for treatment efficacy, adherence, and potential side effects. This failure to provide comprehensive care and follow-up is a significant ethical and professional lapse, potentially jeopardizing patient safety and long-term health outcomes. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available patient data, including history, physical examination, and diagnostic testing. 2. Accurately diagnose the specific sleep disorder, recognizing the nuances of complex conditions like COMP SAS. 3. Consult current clinical practice guidelines and evidence-based literature to inform treatment selection. 4. Consider individual patient factors, comorbidities, and preferences when developing a treatment plan. 5. Implement appropriate therapies, including advanced options when indicated, and monitor patient response closely. 6. Ensure clear communication with the patient and other healthcare providers throughout the treatment process. Question 5. The assessment process reveals a patient experiencing significant daytime somnolence and fragmented nighttime sleep. The clinical team is considering the role of neurotransmitters and hormones in this patient's sleep regulation. Which of the following combinations most accurately reflects key neurochemicals involved in promoting wakefulness and sleep, respectively, and their primary roles in this context? Option A. Acetylcholine wakefulness promotion and melatonin sleep induction. Option B. Norepinephrine wakefulness promotion and gamma-aminobutyric acid GABA sleep induction. Option C. Histamine sleep induction and cortisol wakefulness promotion. Option D. Dopamine sleep induction and serotonin wakefulness promotion. The correct answer is B. Norepinephrine wakefulness promotion and gamma-aminobutyric acid GABA sleep induction. Explanation. The assessment process reveals a patient presenting with a complex sleep disorder, necessitating a thorough understanding of the neurochemical underpinnings of sleep regulation. This scenario is professionally challenging because accurately identifying the neurotransmitters and hormones involved in a patient's sleep disturbances requires integrating knowledge of neurobiology with clinical presentation. Misinterpreting these mechanisms can lead to ineffective or even harmful treatment strategies. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of the physiological basis of sleep. By correctly identifying the primary neurotransmitters and hormones influencing sleep-wake cycles, a clinician can develop targeted and evidence-based interventions. This aligns with the CCSH certification's emphasis on a deep understanding of sleep science and its clinical application, ensuring patient safety and optimal outcomes. Adherence to established scientific literature and clinical guidelines regarding sleep neurochemistry is paramount. An incorrect approach that focuses solely on a single neurotransmitter without considering its interactions with other systems, or one that attributes sleep disturbances to a hormone without sufficient clinical evidence, represents a failure to apply a holistic and evidence-based approach. This could lead to misdiagnosis and inappropriate treatment, potentially exacerbating the patient's condition. Furthermore, relying on anecdotal evidence or unverified information regarding sleep neurochemistry would violate the ethical obligation to provide care based on scientific consensus and best practices, as expected within the scope of the CCSH certification. Professionals should employ a decision-making framework that begins with a thorough patient history and physical examination, followed by a review of relevant diagnostic data. This information should then be cross-referenced with established scientific literature and clinical guidelines pertaining to sleep neurochemistry. When faced with complex presentations, consulting with colleagues or seeking further specialized training in sleep neurobiology is a crucial step in ensuring accurate diagnosis and effective management. The focus must always remain on patient-centered care, grounded in scientific evidence and ethical practice. Question 6. Governance review demonstrates that a clinical sleep health practitioner, upon identifying significant signs of obstructive sleep apnea in a patient during an initial consultation, proceeded to schedule and initiate a diagnostic polysomnogram without obtaining a specific, separate informed consent for this particular study, relying instead on a general consent for medical investigations signed at the patient's first visit. Which of the following actions best reflects the appropriate professional and regulatory response to this situation? Option A. Immediately obtain a specific informed consent for the polysomnogram, explaining the procedure, its purpose, potential risks and benefits, and document this consent before continuing any further diagnostic steps. Option B. Proceed with the polysomnogram as scheduled, assuming implicit consent due to the patient's reported symptoms and the urgency of diagnosis, and address consent documentation retrospectively. Option C. Review the initial general consent form to determine if it broadly covers specialized diagnostic procedures like polysomnography and proceed based on that interpretation. Option D. Acknowledge the general consent for medical investigations as sufficient, given the clear clinical indication for the sleep study and the patient's presumed understanding of the diagnostic process. The correct answer is A. Immediately obtain a specific informed consent for the polysomnogram, explaining the procedure, its purpose, potential risks and benefits, and document this consent before continuing any further diagnostic steps. Explanation. This scenario presents a common implementation challenge in clinical sleep health, balancing the immediate need for diagnostic clarity with the ethical and regulatory imperative to obtain informed consent for all diagnostic procedures. The professional challenge lies in navigating patient autonomy and the potential for diagnostic bias when a clinician, even with good intentions, proceeds with a diagnostic step without explicit patient agreement. The correct approach represents best professional practice because it prioritizes patient autonomy and adheres to the fundamental ethical principle of informed consent, which is implicitly or explicitly mandated by professional guidelines and regulatory frameworks governing healthcare practice. Obtaining informed consent ensures the patient understands the purpose, risks, benefits, and alternatives to the diagnostic test, empowering them to make a voluntary decision. This aligns with the principle of patient-centered care and avoids potential legal or ethical repercussions stemming from unauthorized procedures. Proceeding with a diagnostic sleep study without explicit informed consent, even if the patient has a clear indication for it, represents a regulatory and ethical failure. This failure violates the patient's right to self-determination and bodily integrity. It could be construed as a breach of professional conduct, potentially leading to disciplinary action by regulatory bodies. Furthermore, it undermines the trust essential in the patient-clinician relationship. Another incorrect approach, relying solely on a prior general consent for medical investigations, is insufficient. Specific diagnostic procedures, especially those involving specialized equipment and potential discomfort like polysomnography, require specific consent that details the nature of the investigation. A broad, nonspecific consent obtained at the outset of care may not adequately cover the nuances of a sleep study. A third incorrect approach, assuming the patient implicitly consents due to the severity of their symptoms, is ethically and regulatorily unsound. While a patient's distress is a factor in clinical judgment, it does not negate the requirement for explicit consent. Implicit consent is generally reserved for very low-risk, routine procedures, and even then, explicit consent is preferred. The professional decision-making process for similar situation should involve a clear step-by-step approach. 1. Identify the need for a diagnostic procedure. 2. Assess the patient's capacity to consent. 3. Clearly explain the procedure, its purpose, potential risks, benefits, and alternatives to the patient. 4. Answer all patient questions thoroughly. 5. Obtain explicit, documented, informed consent before proceeding with the diagnostic test. If the patient is unable to consent, follow established protocols for surrogate consent. Question 7. The assessment process reveals a patient diagnosed with central sleep apnea, CSA. Considering the diverse etiologies and treatment modalities for CSA, which of the following represents the most appropriate initial management strategy for this patient? Option A. Prescribe supplemental oxygen therapy without further investigation, assuming it will alleviate the central apneas. Option B. Initiate adaptive servoventilation ASV therapy immediately, as it is a primary treatment for central sleep apnea. Option C. Recommend lifestyle modifications such as weight loss and avoidance of alcohol, as these are universally effective for all types of central sleep apnea. Option D. Conduct a thorough evaluation to identify potential underlying medical conditions contributing to the CSA, and consider polysomnography findings to guide therapy selection. Correct answer is B. Initiate adaptive servoventilation ASV therapy immediately, as it is a primary treatment for central sleep apnea. Explanation: the assessment process reveals a patient with central sleep apnea, CSA, presenting a complex clinical and ethical challenge. The challenge lies in accurately diagnosing the specific subtype of CSA, understanding its underlying etiology, and developing a treatment plan that is both effective and aligns with the patient's overall health status and preferences, while adhering to established clinical guidelines and professional standards of care. This requires a multidisciplinary approach and careful consideration of various treatment modalities, each with its own benefits and risks. The correct approach involves a comprehensive evaluation that includes a detailed patient history, physical examination, and polysomnography (PSG) to confirm the diagnosis of CSA and identify its specific pattern, e.g., Cheyne-Stokes respiration, primary CSA, CSA due to medical conditions. Following diagnosis, the clinician must consider evidence-based treatment options, prioritizing those that address the underlying cause of CSA if identifiable, and employing therapies such as positive airway pressure, PAP devices, e.g., adaptive servoventilation or CPAP with expiratory pressure relief, supplemental oxygen, or pharmacologic interventions as indicated by clinical guidelines and the patient's specific condition. This approach is best professional practice because it is patient-centered, evidence-based, and adheres to the ethical principles of beneficence and non-maleficence by seeking to improve the patient's health outcomes while minimizing harm. It also aligns with the professional responsibility to provide high-quality, individualized care. An incorrect approach would be to immediately prescribe a standard CPAP device without further investigation into the specific type of CSA and its potential underlying causes. This fails to acknowledge that CPAP may not be the most effective or appropriate treatment for all forms of CSA and could potentially worsen certain types of central apneas or be poorly tolerated. Another incorrect approach would be to focus solely on symptom management without investigating the underlying medical conditions that may be contributing to the CSA, such as heart failure or renal disease. This neglects the principle of addressing root causes and could lead to suboptimal patient outcomes. A third incorrect approach would be to dismiss the patient's concerns or preferences regarding treatment options without adequate discussion and exploration of alternatives, which violates the principle of patient autonomy and shared decision-making. Professional decision-making in such situations requires a systematic process. First, accurately diagnose the condition and its contributing factors. Second, review current evidence-based guidelines and literature for treatment options. Third, assess the patient's comorbidities, preferences, and tolerance for different therapies. Fourth, engage in shared decision-making with the patient, explaining the rationale, benefits, and risks of each option. And finally, implement the chosen treatment plan with ongoing monitoring and adjustment as needed. Question 8. The performance metrics show a significant decrease in the prescribed therapy usage for a patient with moderate obstructive sleep apnea who is using positive airway pressure, PAP therapy. The data indicates the patient is using the device for less than 3 hours per night, significantly below the recommended minimum for effective treatment, and mask leak alerts are frequent. The sleep health professional needs to determine the most appropriate next step to address this situation. Option A. Increase the PAP pressure setting remotely to compensate for perceived leaks and encourage longer usage without direct patient consultation. Option B. Schedule a follow-up appointment with the patient to discuss the performance metrics, explore potential barriers to consistent PAP use, and collaboratively develop strategies to improve adherence and mask fit. Option C. Immediately contact the prescribing physician to request a change in the prescribed PAP pressure or mask type, assuming the current settings are the cause of the low usage. Option D. Advise the patient to discontinue PAP therapy temporarily until they can commit to using it for the full prescribed duration to avoid generating further non-compliant data. The correct answer is B. Schedule a follow-up appointment with the patient to discuss the performance metrics, explore potential barriers to consistent PAP use, and collaboratively develop strategies to improve adherence and mask fit. Explanation. This scenario presents a common challenge in clinical sleep health, balancing patient adherence to prescribed treatments with the need to achieve optimal clinical outcomes, all while operating within the established regulatory and ethical guidelines for the Certification in Clinical Sleep Health, CCSH. The professional challenge lies in interpreting performance metrics that indicate a treatment is not being followed as intended, and then determining the most appropriate and ethical course of action without overstepping professional boundaries or making assumptions about patient capacity. The correct approach represents best professional practice because it prioritizes a patient-centered, collaborative, and evidence-based strategy. It acknowledges that adherence issues are complex and often stem from factors beyond simple patient noncompliance. By initiating a conversation with the patient to understand the barriers to adherence, the sleep health professional is acting ethically and in accordance with the principles of informed consent and shared decision-making. This aligns with the CCSH scope of practice, which emphasizes patient education, support, and the identification of factors impacting treatment success. The regulatory framework implicitly supports this by requiring professionals to act in the best interest of the patient and to provide care that is both effective and respectful of patient autonomy. An incorrect approach that involves unilaterally adjusting the prescribed therapy without direct patient consultation and a thorough understanding of the underlying reasons for non-adherence is professionally unacceptable. This could be considered a deviation from the prescribed treatment plan without proper medical oversight, potentially leading to suboptimal outcomes or even adverse effects. Ethically, it undermines patient autonomy and the collaborative nature of treatment. It also fails to address the root cause of the adherence issue, which is a critical failure in providing comprehensive sleep health management. Another incorrect approach, such as immediately escalating to more aggressive or invasive treatments without exploring less intrusive interventions or understanding the patient's perspective, demonstrates a lack of patient-centered care and a failure to exhaust all reasonable avenues for improving adherence to the current, potentially effective, therapy. This can lead to unnecessary patient burden and cost and may damage the therapeutic alliance. The professional decision-making process for similar situations should involve a systematic approach. First, objectively review the performance metrics and identify the specific nature of the non-adherence. Second, initiate a non-judgmental conversation with the patient to explore potential barriers to adherence, such as understanding of the therapy, comfort with the equipment, lifestyle factors, or perceived benefits. Third, based on the patient's feedback, collaboratively develop a revised strategy that may involve further education, equipment adjustments, behavioral interventions, or, if necessary, consultation with the prescribing physician regarding alternative therapies. Throughout this process, maintaining clear communication, respecting patient autonomy, and adhering to the scope of practice are paramount. Question 9. System analysis indicates that a patient presents with fragmented sleep, excessive daytime sleepiness, and reported vivid dreams. When considering the neuroanatomical structures and their physiological functions involved in regulating sleep architecture and the expression of dream states, which of the following represents the most accurate and clinically relevant understanding for a CCSH professional? Option A. The primary driver of sleep fragmentation and altered dream content in this patient is likely a dysregulation within the pontine tegmentum and its influence on REM sleep generation, impacting the balance of inhibitory and excitatory neurotransmission. Option B. The core issue is a structural abnormality in the frontal lobe, causing a complete absence of non-REM sleep stages. Option C. The patient's symptoms are solely attributable to a deficiency in melatonin production by the pineal gland, leading to a generalized disruption of circadian rhythmicity. Option D. The observed sleep disturbances are best explained by a simple overproduction of hypocretin in the lateral hypothalamus, leading to increased wakefulness. The correct answer is A. The primary driver of sleep fragmentation and altered dream content in this patient is likely a dysregulation within the pontine tegmentum and its influence on REM sleep generation, impacting the balance of inhibitory and excitatory neurotransmission. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of the autonomic nervous system's role in sleep regulation and the potential for misinterpretation of physiological data. A sleep health professional must integrate knowledge of neuroanatomy and physiology with clinical presentation to accurately assess a patient's sleep disorder. The challenge lies in distinguishing between normal physiological variations and pathological processes, especially when symptoms are subtle or overlap. Correct approach analysis. The correct approach involves a comprehensive understanding of the interplay between the brainstem, hypothalamus, and limbic system in controlling sleep-wake cycles, including the role of neurotransmitters and hormonal influences. This approach aligns with the CCSH certification's emphasis on a thorough understanding of sleep physiology as foundational to clinical practice. It allows for accurate diagnosis and personalized treatment planning based on the underlying anatomical and physiological mechanisms of the patient's sleep disturbance, adhering to the ethical imperative of providing evidence-based care. Incorrect approaches analysis. One incorrect approach would be to solely focus on subjective patient reports without correlating them with objective physiological data and an understanding of sleep anatomy. This fails to acknowledge the objective, physiological basis of sleep disorders and could lead to misdiagnosis or ineffective treatment, potentially violating the standard of care expected of a certified professional. Another incorrect approach would be to attribute all sleep disturbances to a single, isolated anatomical structure without considering the interconnectedness of neural pathways. Sleep regulation is a complex, multi-system process. Focusing on a single component in isolation ignores the broader physiological context and can lead to an incomplete or inaccurate assessment, failing to meet the comprehensive knowledge requirements for CCSH. A third incorrect approach would be to rely on outdated or disproven physiological models of sleep. The field of sleep science is continually evolving. Adherence to current, evidence-based understanding of sleep anatomy and physiology is crucial for effective clinical practice and is implicitly required by the CCSH certification standards. Professional reasoning. Professionals should approach such scenarios by first gathering all available data, including patient history, subjective reports, and objective polysomnographic findings. This data should then be interpreted through the lens of current, evidence-based knowledge of sleep anatomy and physiology, considering the integrated function of various brain regions and neurotransmitter systems. When faced with ambiguity, consultation with a multidisciplinary team or further investigation to clarify the underlying physiological mechanisms should be pursued. This systematic, evidence-based approach ensures patient safety and promotes optimal sleep health outcomes. Question 10. Risk assessment procedures indicate that a patient diagnosed with parasomnia, specifically sleepwalking, has a history of ambulating and engaging in complex behaviors during episodes, including attempting to leave their residence. The patient's family expresses significant concern about their safety, particularly during unsupervised periods. Which of the following approaches best addresses the immediate safety concerns and promotes effective management of this sleepwalking behavior within a clinical sleep health framework? Option A. Implement a comprehensive safety plan that includes environmental modifications in the patient's home, such as securing windows and doors, and educating the patient and their family on sleep hygiene and potential triggers for sleepwalking episodes. Option B. Prescribe a sedative medication to suppress all sleep stages, aiming to prevent any possibility of sleepwalking episodes from occurring. Option C. Recommend that the patient avoid sleep altogether until the sleepwalking resolves. Option D. Advise the family to simply lock the patient in their room at night to prevent them from wandering. The correct answer is A. Implement a comprehensive safety plan that includes environmental modifications in the patient's home, such as securing windows and doors, and educating the patient and their family on sleep hygiene and potential triggers for sleepwalking episodes. Explanation. This scenario presents a professional challenge due to the inherent safety risks associated with sleepwalking, particularly in a clinical setting where patient well-being is paramount. The need for a comprehensive and individualized risk assessment is critical, as sleepwalking can manifest with varying degrees of complexity and potential for harm. Careful judgment is required to balance patient comfort and autonomy with the imperative to prevent injury. The correct approach represents best professional practice because it prioritizes patient safety through a multifaceted assessment and intervention strategy. This aligns with the ethical obligation to do no harm and the regulatory framework's emphasis on individualized care plans. Specifically, it involves a thorough clinical evaluation to identify triggers and patterns, followed by the implementation of environmental safety measures and patient/caregiver education. This proactive and evidence-based approach ensures that potential risks are mitigated effectively, promoting a safe sleep environment. An incorrect approach that focuses solely on medication management without a comprehensive behavioral and environmental assessment fails to address the root causes and contributing factors of sleepwalking. This is a regulatory and ethical failure because it neglects the holistic nature of patient care and may lead to ineffective treatment or adverse drug reactions. Another incorrect approach that relies solely on patient self-reporting without objective observation or environmental modifications overlooks the potential for impaired judgment during sleepwalking episodes and the need for external safety precautions. This is ethically problematic as it places undue burden on the patient and fails to adequately protect them from harm. A third incorrect approach that dismisses the concern as a minor issue without further investigation is a significant regulatory and ethical failure. It demonstrates a lack of due diligence in patient care and a disregard for potential safety risks, which can have serious consequences. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's presenting symptoms and history. This involves active listening, detailed questioning, and observation. The next step is to conduct a comprehensive risk assessment, considering environmental factors, potential triggers, and the patient's specific sleepwalking behaviors. Based on this assessment, an individualized care plan should be developed, incorporating appropriate interventions such as environmental modifications, behavioral strategies, and, if necessary, pharmacological interventions. Ongoing monitoring and reassessment are crucial to ensure the effectiveness of the plan and to adapt to any changes in the patient's condition. This systematic approach ensures that patient safety is prioritized while respecting their dignity and promoting optimal sleep health. Question 11. Assessment of a patient presenting with recurrent episodes of shouting and thrashing during sleep, which their bed partner describes as violent and frightening, requires a systematic approach to differentiate between potential parasomnias and other sleep-disordered behaviors. Which of the following evaluation strategies best aligns with current best practices for clinical sleep health professionals in the United States, adhering to relevant guidelines? Option A. Relying solely on the patient's subjective description of the events and initiating empirical treatment for a suspected parasomnia based on the severity of the reported behaviors. Option B. A comprehensive diagnostic evaluation including a detailed patient and bed partner interview, review of sleep hygiene, and a full polysomnogram (PSG) with video monitoring to objectively assess for events and their relationship to sleep stages and potential arousals. Option C. Dismissing the reported events as likely nightmares or sleep talking, as these are common and usually benign, and advising the patient to improve their sleep hygiene without further diagnostic testing. Option D. Ordering an electroencephalogram (EEG) to rule out seizure activity as the primary cause of the reported nocturnal events, without a full sleep study, given the violent nature of the behaviors. The correct answer is B. A comprehensive diagnostic evaluation including a detailed patient and bed partner interview, review of sleep hygiene, and a full polysomnogram (PSG) with video monitoring to objectively assess for events and their relationship to sleep stages and potential arousals. Explanation. The scenario presents a common challenge in clinical sleep health, differentiating between a patient's subjective report of a parasomnia and objective findings from diagnostic testing, while also considering the impact on the patient's well-being and safety. The professional challenge lies in synthesizing subjective experiences with objective data to arrive at an accurate diagnosis and effective management plan, adhering to established clinical guidelines and ethical responsibilities. Careful judgment is required to avoid misdiagnosis, inappropriate treatment, and potential harm to the patient. The correct approach represents best professional practice by prioritizing a comprehensive, multifaceted evaluation. This involves not only gathering detailed subjective information about the patient's experiences and their impact, but also correlating this with objective polysomnographic (PSG) data. The CCSH certification emphasizes evidence-based practice and patient-centered care, which necessitates a thorough understanding of the diagnostic criteria for parasomnias as outlined in the International Classification of Sleep Disorders, ICSD, and the American Academy of Sleep Medicine, ASM, guidelines. This approach ensures that treatment decisions are informed by both the patient's lived experience and objective physiological measures, aligning with ethical obligations to provide competent and individualized care. An incorrect approach that relies solely on subjective reporting, without objective confirmation, risks misinterpreting normal sleep phenomena or other sleep disorders as a parasomnia, leading to unnecessary interventions or anxiety. This fails to meet the standard of care for accurate diagnosis and may violate ethical principles of beneficence and non-maleficence by potentially causing harm through inappropriate treatment. Another incorrect approach that dismisses the patient's subjective experience in favor of solely objective findings, especially if the PSG is technically adequate but does not capture the reported events, overlooks the significant distress and functional impairment the patient is experiencing. This can lead to a breakdown in the patient-provider relationship and a failure to address the patient's primary concerns, potentially violating principles of respect for persons and patient autonomy. Relying on outdated or incomplete diagnostic criteria would also represent a failure to adhere to current best practices and regulatory expectations for evidence-based sleep medicine. The professional decision-making process for similar situations should involve a systematic approach. 1. Elicit a detailed history, including the nature of the events, frequency, timing, triggers, associated behaviors, and impact on daily functioning and safety. 2. Correlate subjective reports with objective findings from diagnostic studies, e.g., PSG actigraphy, considering the limitations of each. 3. Consult relevant diagnostic criteria, e.g., ICSD-3 ASM scoring manual for definitive diagnosis. 4. Consider differential diagnoses that may mimic parasomnias. 5. Develop a management plan that is evidence-based, patient-centered, and addresses safety concerns. 6. Regularly reassess the patient's response to treatment and adjust the plan as needed. This iterative process ensures that clinical decisions are grounded in comprehensive data and ethical considerations. Question 12. Comparative studies suggest that while patient self-reporting is a critical component of symptom assessment, objective diagnostic measures are paramount for confirming sleep disorders. A patient presents with complaints of excessive daytime sleepiness, difficulty concentrating, and morning headaches, reporting these symptoms have significantly impacted their daily functioning for over a year. The patient expresses a strong belief that they have a specific sleep disorder and requests immediate treatment based on their perceived symptoms. As a certified clinical sleep health professional, what is the most appropriate initial course of action? Option A. Advise the patient that their symptoms are likely due to lifestyle factors and do not warrant further investigation or intervention, as objective evidence is lacking. Option B. Conduct a thorough clinical interview to gather detailed symptom history, perform a physical examination, and discuss the potential need for objective diagnostic testing such as polysomnography or actigraphy to establish a definitive diagnosis. Option C. Immediately initiate a treatment regimen for the most commonly associated sleep disorder based on the patient's reported symptoms, as their conviction suggests a clear understanding of their condition. Option D. Rely solely on the patient's detailed symptom description and their stated belief about the diagnosis to prescribe medication, as patient satisfaction is a primary indicator of successful care. The correct answer is B. Conduct a thorough clinical interview to gather detailed symptom history, perform a physical examination, and discuss the potential need for objective diagnostic testing such as polysomnography or actigraphy to establish a definitive diagnosis. Explanation. This scenario presents a professional challenge because it requires a sleep health professional to balance the patient's expressed concerns with the objective diagnostic criteria for a specific sleep disorder. The patient's self-reported symptoms, while significant to them, may not perfectly align with the established diagnostic pathway for the suspected condition, creating a potential conflict between patient perception and clinical evidence. Careful judgment is required to ensure the diagnostic process is both thorough and ethically sound, respecting the patient's experience while adhering to professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive and evidence-based diagnostic process. This involves gathering detailed symptom history, conducting a thorough physical examination, and utilizing objective diagnostic tools like polysomnography when indicated. This aligns with the ethical obligation to provide competent care and the regulatory framework that mandates accurate diagnosis and appropriate treatment planning based on established medical guidelines. By systematically evaluating all relevant factors, the professional ensures that the diagnosis is not solely based on subjective reporting, but is supported by objective findings, leading to the most effective and safe patient management. An incorrect approach that relies solely on the patient's self-reported symptoms without further objective investigation fails to meet the standards of clinical practice. This could lead to misdiagnosis, delayed or inappropriate treatment, and potentially harm to the patient. Ethically, it breaches the duty of care by not pursuing all reasonable diagnostic avenues. From a regulatory standpoint, it may violate guidelines that require objective confirmation of diagnosis for certain conditions. Another incorrect approach that dismisses the patient's symptoms outright due to a perceived lack of objective evidence is also professionally unacceptable. This demonstrates a lack of empathy and can erode patient trust, hindering the therapeutic relationship. While objective data is crucial, patient narratives provide vital context and can guide the diagnostic inquiry. Ignoring these can lead to overlooking subtle but significant clinical indicators. A further incorrect approach that immediately jumps to a treatment plan without a confirmed diagnosis, based on incomplete information, is a significant ethical and regulatory failure. This bypasses the fundamental principle of diagnosis before treatment, potentially leading to ineffective or harmful interventions. It also fails to uphold the professional responsibility to ensure that treatment is evidence-based and tailored to a confirmed condition. The professional decision-making process for similar situations should involve a structured approach. 1. Active listening and empathy. Fully acknowledge and validate the patient's reported symptoms and concerns. 2. Comprehensive data gathering. Systematically collect subjective patient history, symptom diaries, and objective physical exam diagnostic test data. 3. Differential diagnosis. Consider all plausible conditions that could explain the patient's presentation. 4. Evidence-based evaluation. Compare the gathered data against established diagnostic criteria for suspected conditions. 5. Collaborative decision-making. Discuss findings and diagnostic possibilities with the patient, involving them in the decision-making process regarding further investigations or treatment. 6. Adherence to standards. Ensure all diagnostic and treatment decisions are in line with current clinical guidelines and regulatory requirements. Question 13. The monitoring system demonstrates a polysomnographic finding of REM sleep without atonia, accompanied by intermittent brief limb movements that are not overtly violent but appear to be associated with vocalizations. The patient's spouse reports that the patient sometimes acts out dreams, occasionally striking the bed frame. What is the most appropriate next step in managing this patient? Option A. Immediately initiate pharmacotherapy with a dopamine agonist, as this is the first-line treatment for REM sleep behavior disorder. Option B. Advise the patient and spouse that the polysomnographic findings are not definitive for REM sleep behavior disorder, and no further action is required at this time. Option C. Correlate the polysomnographic findings with the patient's reported history of dream-enacting behaviors and conduct a thorough clinical assessment to confirm a diagnosis of REM sleep behavior disorder. Option D. Focus solely on the vocalizations observed during REM sleep and investigate for a primary sleep-related breathing disorder. The correct answer is C. Correlate the polysomnographic findings with the patient's reported history of dream-enacting behaviors and conduct a thorough clinical assessment to confirm a diagnosis of REM sleep behavior disorder. Explanation. The monitoring system demonstrates a pattern of REM sleep behavior disorder, RBD, in a patient. This scenario is professionally challenging because accurately diagnosing and managing RBD requires careful interpretation of polysomnography, PSG, data, consideration of potential underlying causes, and adherence to established clinical guidelines for sleep disorders. The challenge lies in distinguishing true RBD from other parasomnias or movement disorders that can occur during sleep, and in ensuring the patient's safety and the safety of their bed partner. The correct approach represents best professional practice by prioritizing a comprehensive clinical assessment that integrates PSG findings with the patient's reported history and physical examination. This aligns with the Certification in Clinical Sleep Health (CCSH) framework's emphasis on a holistic patient evaluation. Specifically, it involves correlating the observed PSG features of REM sleep without muscle atonia with the patient's reported dream-enacting behaviors. This thorough approach ensures an accurate diagnosis, which is crucial for initiating appropriate management strategies, such as pharmacotherapy or behavioral intervention, and for ruling out other potential sleep disorders or medical conditions that might mimic RBD. Adherence to these diagnostic and management principles is implicitly guided by the ethical obligation to provide competent and evidence-based care, as expected of certified professionals. An incorrect approach that involves solely relying on the PSG data without further clinical correlation is professionally unacceptable. This failure to integrate subjective patient reports and objective PSG findings can lead to misdiagnosis. For instance, isolated REM without atonia on PSG, without corresponding behavioral symptoms, might not meet the diagnostic criteria for RBD and could be a normal variant or indicative of another condition. This would violate the ethical principle of beneficence by potentially leading to unnecessary treatment or delayed diagnosis of the actual issue. Another incorrect approach that focuses only on prescribing medication based on the PSG findings, without a thorough clinical evaluation, is also professionally unacceptable. This bypasses the essential step of understanding the patient's specific symptoms, their impact on quality of life, and potential triggers or comorbidities. Such an approach risks inappropriate pharmacotherapy, potentially leading to side effects or masking other underlying conditions, thereby failing to uphold the ethical duty of non-maleficence and the professional standard of providing individualized care. A further incorrect approach that dismisses the PSG findings as insignificant without further investigation, based on a lack of overt physical signs during the sleep study, is professionally unsound. RBD can manifest subtly, and the absence of dramatic physical movements during a brief observation period does not negate the possibility of the disorder, especially if the PSG data strongly suggests it. This oversight could lead to a misdiagnosis, preventing the patient from receiving necessary treatment and potentially leading to harm to themselves or others due to uncontrolled nocturnal behaviors. This constitutes a failure in professional diligence and adherence to diagnostic best practices. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review all available data, including PSG, patient history, and physical examination findings. Second, critically analyze the PSG data in the context of the patient's clinical presentation, looking for concordant evidence. Third, consider differential diagnoses that could explain the observed phenomena. Fourth, consult relevant clinical guidelines and literature to inform diagnostic and management decisions. Finally, engage in shared decision-making with the patient regarding treatment options, ensuring they understand the diagnosis, risks, benefits, and alternatives. Question 14. To address the challenge of accurately diagnosing and managing obstructive sleep apnea, OSA, in a patient presenting with symptoms suggestive of the disorder, which of the following actions best aligns with the regulatory framework and guidelines governing the Certification in Clinical Sleep Health, CCSH? Option A. Prescribing positive airway pressure, PAP, therapy immediately upon suspicion of OSA, without objective diagnostic confirmation. Option B. Recommending a home sleep apnea test, HSAT, or full polysomnography, PSG, for objective diagnosis, followed by a treatment plan based on the confirmed findings and established clinical guidelines. Option C. Relying solely on the patient's subjective report of snoring and daytime sleepiness to initiate treatment for suspected OSA. Option D. Referring the patient to a general practitioner for an OSA diagnosis and treatment plan, without direct involvement in the diagnostic process. The correct answer is B. Recommending a home sleep apnea test, HSAT, or full polysomnography, PSG, for objective diagnosis, followed by a treatment plan based on the confirmed findings and established clinical guidelines. Explanation. The scenario presents a common challenge in clinical sleep health, ensuring accurate and compliant diagnosis and management of obstructive sleep apnea, OSA, within the established regulatory framework for the Certification in Clinical Sleep Health, CCSH. Professionals must navigate patient care while adhering to specific guidelines that dictate acceptable diagnostic modalities and treatment pathways. The challenge lies in balancing patient needs with the strict requirements of the certification, which emphasizes evidence-based practice and adherence to recognized standards. The correct approach represents best professional practice because it directly aligns with the CCSH emphasis on utilizing validated diagnostic tools and adhering to established clinical guidelines for OSA management. This ensures patient safety, diagnostic accuracy, and compliance with the professional standards expected of a certified individual. It reflects a commitment to evidence-based medicine and the ethical responsibility to provide care that is both effective and regulated. An incorrect approach that relies solely on patient-reported symptoms without objective polysomnography fails to meet the diagnostic rigor required by the CCSH. This is a regulatory failure because OSA is a diagnosed medical condition requiring objective confirmation, not subjective assessment alone. Ethically, it represents a failure to provide a standard of care that is both accurate and safe, potentially leading to misdiagnosis or delayed treatment. Another incorrect approach that involves prescribing a treatment without a confirmed diagnosis of OSA is a significant regulatory and ethical breach. The CCSH certification implies competence in diagnosing and managing sleep disorders. Initiating treatment without a confirmed diagnosis violates established medical practice and regulatory expectations for evidence-based treatment initiation. This could lead to inappropriate treatment, patient harm, and a failure to address the actual underlying condition. A third incorrect approach that involves delegating the interpretation of diagnostic studies to an unqualified individual is also a regulatory and ethical failure. The CCSH certification signifies a level of expertise in sleep health, including the interpretation of sleep studies. Such delegation undermines the integrity of the diagnostic process and potentially compromises patient care, violating the professional responsibility to ensure competent oversight of diagnostic procedures. A professional decision-making process for similar situations should involve a systematic evaluation of the patient's presentation against established diagnostic criteria. This includes identifying the need for objective testing, e.g., polysomnography, when OSA is suspected. Professionals must then adhere to the accepted guidelines for interpreting these tests and subsequently developing a treatment plan based on the confirmed diagnosis. Continuous adherence to regulatory frameworks and ethical principles is paramount in ensuring high-quality patient care and maintaining professional integrity. Question 15. Stakeholder feedback indicates that some patients presenting with difficulty sleeping are experiencing varied symptom profiles. A patient reports being unable to fall asleep for several hours on most nights for the past 3 weeks, which is a new occurrence following a significant work-related stressor. They also report feeling tired and irritable during the day. Based on this information, which of the following best categorizes this patient's insomnia? Option A, primary insomnia without identifiable cause. Option B, sleep maintenance insomnia due to environmental factors. Option C, acute insomnia related to a specific stressor. Option D, chronic insomnia with sleep onset difficulties. The correct answer is C, acute insomnia related to a specific stressor. Explanation: this scenario presents a professional challenge due to the nuanced presentation of insomnia symptoms, requiring careful differentiation to ensure appropriate clinical management and adherence to the standards of practice expected for a certified clinical sleep health professional. Misclassifying the type of insomnia can lead to ineffective treatment strategies, patient dissatisfaction, and potential noncompliance with clinical guidelines. The CCSH certification emphasizes a thorough understanding of sleep disorders and their management, including accurate diagnosis based on presenting symptoms and patient history. The correct approach represents best professional practice because it prioritizes a comprehensive assessment to accurately identify the specific type of insomnia. This aligns with the ethical obligation to provide patient-centered care and the regulatory expectation to practice within the scope of one's expertise, utilizing evidence-based diagnostic criteria. By systematically evaluating the onset, duration, and contributing factors of the sleep disturbance, the professional can determine if the insomnia is primarily acute, situational, or chronic, and further differentiate between subtypes like sleep onset, sleep maintenance, or early morning awakening insomnia. This detailed diagnostic process is fundamental to developing an effective, individualized treatment plan. An incorrect approach that focuses solely on the duration of symptoms without exploring the underlying causes or specific sleep difficulties fails to meet the standards of clinical sleep health. This could lead to a misdiagnosis, such as labeling a transient situational insomnia as a chronic disorder, or vice versa, resulting in inappropriate interventions. Ethically, this represents a failure to provide competent care. Another incorrect approach that relies on a single symptom without considering the broader clinical picture, such as only focusing on difficulty falling asleep, might overlook other critical aspects of the insomnia presentation, like frequent awakenings or early morning awakenings, leading to an incomplete and potentially inaccurate diagnosis. This violates the principle of thoroughness in patient assessment. A third incorrect approach that immediately suggests a pharmacological intervention without a proper diagnostic workup is a significant regulatory and ethical failure. It bypasses the essential step of understanding the nature and cause of the insomnia, potentially leading to the prescription of medication for a condition that might be better managed with behavioral or environmental interventions, or for which the medication may be ineffective or even harmful. This demonstrates a lack of adherence to evidence-based practice and a disregard for patient safety. Professional decision-making process for similar situation should involve a systematic approach. First, actively listen to the patient's chief complaint and detailed sleep history. Second, conduct a thorough assessment including questionnaires and potentially sleep diaries to gather objective and subjective data. Third, apply established diagnostic criteria for insomnia, considering factors like onset, duration, severity, and impact on daytime functioning. Fourth, differentiate between acute and chronic insomnia, and within chronic insomnia, identify specific subtypes. Finally, develop a treatment plan tailored to the identified type of insomnia, prioritizing non-pharmacological interventions where appropriate and consulting with other healthcare professionals when necessary. Question 16. Process analysis reveals a patient presenting with chronic complaints of difficulty initiating sleep and early morning awakenings, leading to significant daytime fatigue and impaired functioning. The patient reports a consistent sleep-wake schedule, but their subjective experience is one of misalignment with typical societal norms. They deny symptoms suggestive of restless leg syndrome, sleep apnea, or significant psychiatric distress. What is the most appropriate initial step in evaluating this patient for a potential circadian rhythm disorder? Option A. Conduct a comprehensive sleep history, including detailed sleep-wake logs, and consider actigraphy to objectively assess sleep timing and patterns. Option B. Prescribe a hypnotic medication to address the immediate sleep onset and maintenance difficulties. Option C. Initiate a trial of timed bright light therapy and melatonin supplementation based on the subjective report of misalignment. Option D. Refer the patient for a psychiatric evaluation to rule out underlying mood or anxiety disorders as the primary cause of their sleep complaints. The correct answer is C. Initiate a trial of timed bright light therapy and melatonin supplementation based on the subjective report of misalignment. Explanation. This scenario presents a common challenge in clinical sleep health, differentiating between a primary circadian rhythm disorder and symptoms that may be secondary to other factors, while adhering to established diagnostic and treatment guidelines. The professional challenge lies in accurately assessing the patient's subjective complaints and objective findings to arrive at a correct diagnosis, which then dictates the appropriate therapeutic interventions. Misdiagnosis can lead to ineffective or even harmful treatments, impacting patient well-being and potentially violating professional standards of care. The correct approach involves a comprehensive evaluation that systematically rules out other potential causes of sleep disturbance, while thoroughly investigating the characteristics of the suspected circadian rhythm disorder. This includes detailed history taking, sleep diaries, and potentially objective measures like actigraphy or polysomnography, all interpreted within the context of established diagnostic criteria for circadian rhythm sleep-wake disorders. This aligns with the CCSH certification's emphasis on evidence-based practice and patient-centered care, ensuring that interventions are tailored to the specific underlying pathology. Adherence to these diagnostic pathways is implicitly required by the professional standards expected of a certified clinical sleep health professional, focusing on accurate diagnosis before initiating treatment. An incorrect approach would be to immediately prescribe light therapy or melatonin without a thorough differential diagnosis. This fails to address potential underlying conditions that might mimic circadian rhythm disorders, such as depression, anxiety, or other sleep disorders like insomnia or sleep apnea. Ethically and professionally, this bypasses the fundamental requirement of accurate diagnosis, potentially leading to inappropriate treatment and a failure to address the patient's true needs. Another incorrect approach would be to rely solely on subjective patient reports without seeking objective data or considering other contributing factors. This neglects the objective component of sleep assessment crucial for diagnosing circadian rhythm disorders and could lead to misinterpretation of symptoms. A third incorrect approach might involve treating the symptoms of daytime sleepiness without investigating the root cause, which could be a circadian misalignment. This reactive approach fails to address the underlying disorder and is not a sustainable or evidence-based strategy for managing circadian rhythm disturbances. The professional decision-making process should begin with a detailed patient history, including sleep habits, work schedule, social life, and any coexisting medical or psychiatric conditions. This should be followed by the use of validated tools such as sleep diaries and actigraphy to objectively assess sleep patterns and timing. A thorough differential diagnosis is essential, considering other sleep disorders and medical conditions. Once a suspected circadian rhythm disorder is identified, the specific type should be determined based on established diagnostic criteria. Treatment should then be initiated based on the confirmed diagnosis and tailored to the individual patient's needs and lifestyle, with ongoing monitoring and adjustment as necessary. Question 17. The risk matrix shows a patient with newly diagnosed type 2 diabetes and a BMI of 35 kg/m2, presenting with daytime somnolence and snoring. Which of the following diagnostic and management approaches best aligns with current best practices for integrated sleep and metabolic health management? Option A. Prescribe stimulant medication for daytime somnolence while initiating a low-carbohydrate diet for diabetes management. Option B. Initiate aggressive glycemic control and weight management strategies, deferring a formal sleep study until metabolic parameters stabilize. Option C. Schedule a comprehensive polysomnography to evaluate for sleep-disordered breathing, followed by a multidisciplinary consultation for diabetes and obesity management. Option D. Recommend lifestyle modifications for weight loss and improved sleep hygiene, with a follow-up appointment in 6 months to reassess symptoms. The correct answer is B. Initiate aggressive glycemic control and weight management strategies, deferring a formal sleep study until metabolic parameters stabilize. Explanation: the risk matrix shows a patient presenting with newly diagnosed type 2 diabetes and a history of significant obesity, both of which are strongly associated with sleep-disordered breathing, particularly obstructive sleep apnea, OSA. The professional challenge lies in prioritizing the diagnostic and management pathway for this complex metabolic and sleep presentation, ensuring adherence to best practices and relevant clinical guidelines within the scope of the Certification in Clinical Sleep Health (CCSH) framework. This requires a systematic approach that considers the interconnectedness of these conditions and the potential impact on patient outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive sleep evaluation, including polysomnography, as a foundational step in understanding the patient's sleep architecture and identifying potential OSA. This aligns with established clinical guidelines for the management of patients with diabetes and obesity, which recognize OSA as a significant comorbidity that can exacerbate glycemic control and cardiovascular risk. By directly addressing the sleep disorder, clinicians can implement targeted therapies, e.g., CPAP, that may positively influence metabolic parameters, thereby improving overall patient health and reducing the risk of complications. This proactive and integrated approach is ethically sound, prioritizing patient well-being and evidence-based care. An incorrect approach that focuses solely on managing diabetes and obesity without a concurrent sleep assessment fails to acknowledge the bidirectional relationship between sleep disorders and metabolic health. This represents a regulatory and ethical failure by not adhering to comprehensive patient care standards. It overlooks a critical contributing factor to the patient's metabolic dysfunction, potentially leading to suboptimal treatment outcomes and continued health deterioration. Another incorrect approach that delays or dismisses the need for a sleep study based on perceived patient burden or cost, without a thorough risk-benefit analysis, violates the ethical principle of beneficence and may contraindicate the standard of care expected for patients with this constellation of symptoms. This could also be seen as a failure to uphold professional responsibilities to advocate for necessary diagnostic evaluations. The professional reasoning process for similar situations should involve a thorough review of the patient's presenting symptoms and comorbidities. Clinicians must consult current, evidence-based clinical practice guidelines relevant to sleep health and metabolic disorders. A systematic risk assessment should be performed, considering the potential impact of undiagnosed sleep disorders on the patient's overall health trajectory. Decision-making should prioritize interventions that address the most significant contributing factors to the patient's health status, with a focus on integrated care models that bridge sleep and metabolic health management. Question 18. Consider a scenario where a 22-year-old college student presents with a chief complaint of difficulty falling asleep at night and feeling excessively tired during the day. They report consistently going to bed after 3:00 a.m. and struggling to wake up for their morning classes, often feeling groggy until late afternoon. They deny any significant stressors or changes in their daily routine beyond typical academic pressures. They have tried over-the-counter sleep aids with minimal relief. As a certified clinical sleep health professional, what is the most appropriate initial course of action to assess and manage this patient's presentation? Option A. Conduct a thorough clinical interview to gather detailed sleep history, inquire about lifestyle factors, and assess for symptoms consistent with delayed sleep phase disorder, while also considering the need for objective sleep monitoring such as actigraphy. Option B. Advise the patient to simply force themselves to go to bed earlier each night, even if they do not feel tired, and to avoid all electronic devices in the hours before attempting sleep. Option C. Focus solely on the patient's self-reported bedtime and wake times, assuming the symptoms are primarily due to poor sleep hygiene and recommending a standard sleep hygiene education handout. Option D. Immediately prescribe a short-acting hypnotic medication to help the patient fall asleep earlier, and advise them to set multiple alarms for morning wakefulness. The correct answer is A. Conduct a thorough clinical interview to gather detailed sleep history, inquire about lifestyle factors, and assess for symptoms consistent with delayed sleep phase disorder, while also considering the need for objective sleep monitoring such as actigraphy. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in assessing sleep patterns and the potential for misdiagnosis or inadequate treatment of delayed sleep phase disorder, DSPD. Clinicians must navigate patient self-reporting, objective data, and establish diagnostic criteria while adhering to professional standards and ethical obligations. The core of the challenge lies in differentiating true DSPD from other sleep-wake disorders or lifestyle factors that mimic its symptoms, ensuring patient safety and efficacy of care. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that aligns with the diagnostic guidelines for sleep disorders. This involves a thorough clinical interview to gather detailed sleep history, exploration of potential contributing factors, and the use of objective measures like actigraphy or polysomnography when indicated. This multifaceted approach ensures an accurate diagnosis, which is fundamental for developing an effective and individualized treatment plan. Adherence to these diagnostic and treatment protocols is implicitly required by the professional standards expected of a certified clinical sleep health professional, emphasizing patient-centered care and the application of validated methodologies. An incorrect approach that relies solely on patient self-report without objective verification fails to meet professional standards. This could lead to misdiagnosis, potentially resulting in inappropriate interventions that do not address the underlying issue and could even exacerbate sleep problems. Ethically, this approach neglects the responsibility to provide care based on robust evidence and thorough evaluation, potentially violating the principle of beneficence by not acting in the patient's best interest. Another incorrect approach that involves immediate prescription of pharmacological interventions without a comprehensive diagnostic workup is also professionally and ethically unsound. This bypasses the crucial step of establishing a definitive diagnosis and understanding the contributing factors to the sleep disturbance. Such an approach risks masking underlying conditions, causing adverse drug reactions, and failing to address the root cause of the sleep disorder, thereby violating the principle of non-maleficence and the duty to provide competent care. A professional decision-making process for similar situations should begin with a detailed patient history and symptom review. This should be followed by an assessment of the need for objective data collection, e.g., sleep diary, actigraphy. Based on the gathered information, the clinician should then apply established diagnostic criteria for sleep-wake disorders. Treatment planning should be collaborative with the patient, evidence-based, and tailored to the individual's specific diagnosis and circumstances, with ongoing monitoring and adjustment as needed. This systematic approach ensures that clinical decisions are informed, ethical, and aligned with the highest standards of practice in sleep health. Question 19. The investigation demonstrates a patient experiencing significant daytime sleepiness and difficulty initiating sleep at their desired times, with a history of inconsistent work schedules and frequent travel across time zones. Objective data from actigraphy reveals a pattern of fragmented sleep and a sleep-wake cycle that appears to be shifting irregularly over several weeks, not aligning with typical 24-hour periods. Considering the potential for a circadian rhythm sleep-wake disorder, which of the following diagnostic approaches best aligns with current clinical guidelines for assessing and managing such conditions? Option A. A single night of polysomnography to rule out other primary sleep disorders, with the assumption that any observed circadian disruption is secondary and will resolve with general sleep hygiene advice. Option B. A detailed chronobiological assessment including patient history of light exposure, social Zeitgebers, melatonin secretion patterns, and a comprehensive sleep diary, alongside actigraphy, to precisely characterize the endogenous circadian phase and amplitude. Option C. A broad questionnaire assessing general sleep quality and daytime alertness, assuming the symptoms are primarily due to poor sleep hygiene exacerbated by lifestyle factors. Option D. A trial of a hypnotic medication to immediately address the patient's sleep initiation difficulties and daytime sleepiness, while further evaluating the underlying cause. Correct answer is B. A detailed chronobiological assessment including patient history of light exposure, social Zeitgebers, melatonin secretion patterns, and a comprehensive sleep diary, alongside actigraphy, to precisely characterize the endogenous circadian phase and amplitude. Explanation. The investigation demonstrates a patient presenting with symptoms suggestive of a circadian rhythm disorder. The challenge lies in accurately differentiating between various circadian rhythm, sleep-wake disorders, and identifying the underlying physiological mechanisms and contributing factors. This requires a thorough understanding of chronobiology, sleep physiology, and the diagnostic criteria outlined by relevant professional bodies, such as the American Academy of Sleep Medicine (ASM) and the International Classification of Sleep Disorders (ICSD). The CCSH certification emphasizes the application of evidence-based practices in sleep health, necessitating a systematic and evidence-driven approach to diagnosis and management. The correct approach involves a comprehensive assessment that integrates patient history, sleep diaries, actigraphy, and potentially polysomnography, interpreted within the framework of established diagnostic guidelines. This approach prioritizes identifying the specific type of circadian rhythm disorder, e.g., delayed sleep-wake phase disorder, advanced sleep-wake phase disorder, irregular sleep-wake rhythm disorder, non-24-hour sleep-wake rhythm disorder, and its impact on the patient's functioning. It aligns with best professional practice by adhering to the diagnostic standards that ensure accurate identification and guide appropriate therapeutic interventions, such as light therapy, melatonin, and behavioral strategies, all aimed at re-entraining the endogenous circadian system. This is ethically sound as it prioritizes patient well-being through accurate diagnosis and evidence-based care. Incorrect approaches fail to meet these standards. One incorrect approach might involve solely relying on subjective patient reports without objective data, leading to misdiagnosis or overlooking coexisting sleep disorders. This is professionally unacceptable as it deviates from evidence-based practice and can result in ineffective or even harmful treatment. Another incorrect approach could be to immediately prescribe a generic sleep medication without a thorough circadian rhythm assessment. This fails to address the root cause of the circadian disruption and may mask symptoms or create new problems, violating the ethical principle of beneficence and non-maleficence. A third incorrect approach might involve applying treatments without considering the specific chronotype or environmental factors influencing the patient's circadian rhythm, leading to suboptimal outcomes and a failure to provide individualized care. The professional decision-making process for similar situations should involve a systematic evaluation. First, gathering comprehensive subjective and objective data. Second, applying established diagnostic criteria to identify the specific sleep disorder. Third, considering differential diagnoses. Fourth, developing a personalized, evidence-based treatment plan. And finally, monitoring the patient's response and adjusting the plan as needed. This iterative process ensures that care is patient-centered, evidence-based, and ethically sound, adhering to the principles of the CCSH certification. Question 20. Upon reviewing a patient's subjective report of an irresistible urge to move their legs, accompanied by uncomfortable sensations that worsen at rest and are temporarily relieved by movement, which of the following diagnostic and management approaches best aligns with established clinical practice for restless leg syndrome (RLS)? Option A. Conduct a thorough patient history focusing on the specific characteristics of the sensations, timing, and relief factors, perform a physical examination, and consider objective investigations if indicated by the clinical picture to confirm RLS diagnosis and rule out contributing factors before initiating treatment. Option B. Immediately prescribe medication for RLS based on the patient's description of an urge to move their legs, as this is a classic symptom. Option C. Focus solely on managing the patient's reported discomfort with symptomatic relief measures, without investigating the underlying cause or confirming a diagnosis of RLS. Option D. Advise the patient that these symptoms are common and often resolve on their own without further investigation or specific treatment. The correct answer is A. Conduct a thorough patient history focusing on the specific characteristics of the sensations, timing, and relief factors, perform a physical examination, and consider objective investigations if indicated by the clinical picture to confirm RLS diagnosis and rule out contributing factors before initiating treatment. Explanation. This scenario presents a common challenge in clinical sleep health, differentiating between a patient's subjective experience and objective diagnostic criteria, particularly when symptoms overlap with other conditions. The professional challenge lies in ensuring accurate diagnosis and appropriate management for restless leg syndrome, RLS, while adhering to established clinical guidelines and ethical responsibilities to the patient. Careful judgment is required to avoid misdiagnosis, delayed treatment, or unnecessary interventions. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that aligns with the diagnostic criteria for RLS as established by relevant professional bodies. This includes a detailed history, physical examination, and consideration of objective diagnostic tools when indicated. This methodical approach ensures that the diagnosis is well supported, leading to effective and evidence-based treatment. It also upholds the ethical obligation to provide patient-centered care based on accurate assessment. An incorrect approach that relies solely on a patient's self-report without further investigation fails to meet the diagnostic threshold for RLS and could lead to inappropriate treatment or a misdiagnosis of an underlying condition contributing to the symptoms. This represents a failure to adhere to professional standards of care and potentially violates ethical obligations to provide thorough and accurate assessments. Another incorrect approach that immediately attributes symptoms to RLS without considering other potential etiologies, such as iron deficiency anemia, peripheral neuropathy, or medication side effects, is diagnostically unsound. This hasty conclusion can lead to ineffective treatment and delay the identification of the true cause of the patient's discomfort, which is a breach of professional responsibility. A further incorrect approach that focuses solely on pharmacological interventions without exploring non-pharmacological management strategies or the underlying causes of RLS neglects a holistic approach to patient care. This can result in suboptimal outcomes and overlooks the importance of addressing contributing factors, which is a deviation from best practices in clinical sleep health. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly gather patient history, including symptom characteristics, onset, duration, aggravating and alleviating factors, and impact on daily life. 2. Conduct a comprehensive physical and neurological examination to identify any contributing medical conditions. 3. Consider differential diagnoses and order appropriate investigations, e.g., iron studies, nerve conduction studies, if indicated by the clinical presentation. 4. Apply established diagnostic criteria for RLS. 5. Develop a personalized treatment plan that may include non-pharmacological and pharmacological interventions tailored to the individual patient's needs and preferences. 6. Regularly reassess the patient's response to treatment and adjust the plan as necessary.